Better late than never. I think that is what I'm going to use for this moment, because I am so guilty of not giving you the update as directed, but here now, and I'm glad that we are able to rejoin in. Thank you very much and welcome. This is Eti at Nashville. Welcome to my YouTube channel. Here we discuss health and we discuss lifestyle and we give updates, especially on the COVID-19 that is going on. Okay, so karibuni sana, and we are going to digest our update into 4 parts. That is what I have been going through and trying to siphon through the data that I received, and to give us at least an understandable and mini updates that chap and we go on to something else. So the major thing that we wanted to ask about is about the transmissibility. Why is Omicron so transmissible than the other variants? Okay, so in transmission they've found out so many factors are affecting the transmissibility of Omicron, and these go from a length of how far you are, how much you're exposed to that person who is transmitting the infection, how far are the proximity between the two of you, how is the ventilation of the room, and also the barrier methods. You know, people have gotten fatigued with the masks and all this social distancing thing, and they're just trying to make things go back to normal, which we are in the new normal. You can't go back to how we used to be. Okay. And as we head towards the festive season, there's this jitters that is going to go up, and it has already started going up. The infection rates have started going up of COVID-19. The detection rates have gone up here in Kenya, and even in the northern hemisphere in the UK. Many people are being hospitalized now because of COVID. Okay, so the key factor that they came up, other than the other factors we had discussed before, the key factors, they found out that the spike in the lab with the researchers, that the spike protein of Omicron is highly able to attach to the human protein, so to be able to cause this infection. That is how it transmits very fast. Okay, and once the virus gets into your system, it starts replicating, that is making copies. Yeah, so when it makes copies, there's either slow evolution or a combination. Yeah, so it changes, it morphs slowly according to your body system, changes. What comes out is definitely something different, and that is how we call slow evolution. It evolves slowly, or it combines. Okay, so it's you'll have either the older variant in you or the new variant that you have also produced yourself from your own body system. Remember, the evolution of viruses is a natural process, so nobody should say that maybe the people who are vaccinated are the ones that are making these viruses come out in many variants. No, that is not true. The viruses morph and they evolve and they make new variants. It is their natural process. Okay, so we cannot blame anyone, the unvaccinated or the vaccinated. Okay, and also the number 2, we were worried about the mildness of COVID. Yeah, so they found out from the research that came in from South Africa that it is full range. Yeah, from very mild disease to moderate disease to severe disease. Okay, so let us not focus on it being very mild. It goes the whole range of infection. Okay, so right now the thing that we are supposed to put in our head, this is point number 3, that Delta is still on ground. Okay, and it's still dominant. Yeah, Omicron has just come in, but we still have Delta on ground. So if we still have Delta that is virulent and it's going on, and now we have this Omicron that is coming in, and we are not still following the protocols of prevention, then we stand a higher chance of running into severe diseases and bigger outbreaks. So it is just good that we go back to ourselves. Other than having been immunized, you still have to follow the prevention protocols, and we know all these prevention protocols. We have been singing them for the past 2 years. Because we have Delta and still Omicron is now on ground, there is a likelihood they are going to co-circulate. Okay, so there will still be circulation of Omicron and Delta all together, continuing and giving in the disease. So we're still in the pandemic, or one will extinct and the other one will continue. So they are still in that phase of trying to figure out what will happen, and only time will tell as the researchers come out and the data is collected. And now in Kenya we are worried, yeah. For the past 1 week, people have been having cough, running nose, flu-like symptoms, body aches, sore throat, muscle pains, and we are lucky enough the CDC has come out and they've told us that it is influenza type A virus, the H3N2 virus that is going on, and it's still like it is a flu virus, okay? It's a cousin to the COVID virus. So now we have another thing with us. So it means that we still need to be very cautious because it spreads the same way, it causes the same range of disease manifestation from mild to moderate to severe of influenza, and the symptoms are similar to the one of COVID. And the other thing is they can coexist. So you can still have the Delta variant and then get influenza on top of it. And that means that you will not definitely have a mild disease. You might end up being hospitalized because of co-infection, okay? Though the rate of co-infection is low, but it's still there. At a percentage, it's still there. So we need to take precaution and know that we can get both of them, and the outcome might not be good. So let us be on the lookout, okay? And number 4 and final is that they're trying to work out on antivirals, okay, that on management and giving us an option of using antivirals, especially for those people who are stand a higher risk of getting into severe forms. Those are the elderly and those with morbidities, those are the medical conditions, yeah, that we've already mentioned before in our earlier videos. So, and also maybe the frontline workers, the healthcare workers, in case you get cold, you get COVID, you start on antiviral medication. But that is something they're still working on, and they will give us a report. And the other thing they're worried about giving this open book about using antivirals is because of resistance, yeah. So if everybody is given the chance to use antivirals, then definitely everybody will run for it, and we kind of can get into resistance with these antivirals. So it's still work in progress, it's still in the pipeline, so we will still wait up for more updates and give it to you as it comes in. From me today, thank you very much for waiting in and subscribing and watching my videos and sharing them. Thank you very much. Let us keep on doing that. Your network is your net worth, and you're my network, so you're my net worth. All right, I love you very much and have a great day, and see you later. Bye.